Well, I just said to Sister Jane how pleased I was to see experts, but also people, citizens who haven't been engaged in this conversation here, participating in the discussion. That's what's so important about health, which is a very personal issue, is that citizens understand, get engaged, raise their voices. And the Pell Center has presented some real expertise at these panels, but also invited the public in to participate, and I think that's wonderful.
The political cartoon that has been inflated around Obamacare is basically a distraction from the real issues that are facing our country. Not only is immense progress being made to deliver a more efficient, more humane, and less expensive healthcare system, Rhode Island is very much a leader in that movement.
Healthcare reform needs to happen. Whatever you think of the national law, we have costs we can't afford. Small business owners can't afford them. Families can't afford them. Government can't afford for the people that we pay for, both at the federal and state level. We need to deliver care differently, more efficiently, but with quality at the forefront. This national law gives us some great opportunities to do that, but no matter what happens in the Supreme Court, we will move forward in Rhode Island. We've been a national leader and we will continue to be.
One day, and one day soon, there's going to become a point of no return when healthcare cost is no longer manageable. And if we haven't laid the groundwork for the humane and efficient reform, what we'll end up doing is subsidizing our wasteful system by cutting benefits to the elderly, to the disabled, to people who really need help and shouldn't be the victims in all this. It would be a disgrace and it would be very lazy for us to follow that path. But we're closing in on that point and it's going to happen soon. And so that's why I'm pushing so hard. There's a smart course for us to take that causes a lot less suffering, and we need to work to make that come true.
Your health is so important to your family security, to your personal happiness. It's also a huge economic issue, and I care deeply about what happens in our hospitals, what happens to families where someone is ill, and I fundamentally believe we should not be a country where if you become ill, you need to worry about losing your home. It's too important. Someone asked today, is healthcare right in our country? I believe it is, and we need to make that a reality for people.
To me, as a successor to Claiborne Pell in the Senate, his great legacy was that he saw ahead of the battles of the moment and laid the foundation for lasting programs like National Endowment for the Arts, National Endowment for the Humanities, the Pell Grants, Amtrak. He was a visionary. And what the Pell Center allows us to do is work together on collective visions and put some practical teeth to them. So when the moment of possibility arrives, we're ready and we don't miss those opportunities.